Well, hello, I'm Jennifer Blomquist. Thanks so much for tuning into HealthLine tonight. If you're new to the show, welcome. I'm so glad you joined us. I guarantee you will enjoy the program because you learn so much. I learn stuff every week, and I've been doing the show for like 16 years. So, and we have a wonderful guest tonight. She hasn't been on with us for a while, but I'm so glad she's back. And we're going to be talking about women's health issues, in particular hormones. So I want to make sure that you listen closely to the directions regarding calling in about any questions you have, and also the phone number. So there it is, already at the bottom of the screen. The phone lines are open now, and they'll be open until just about 8 o'clock. It's 969-2720. It's a free call if you're outside of Fort Wayne, as long as you put an 866 in front of there. And when you call in, you have two options. You can ask your question live, which I think is great because then you can interact with the doctor, and she may have some questions to ask of you to give you a better answer. But if you'd rather not do that, I completely understand. You can just talk to the call screener and relay your question to them, and they will give it to me, and then we'll get your question answered that way. Also want to remind you that we tend to get more questions later in the show, and then we can get backed up. So call sooner rather than later. And let's go ahead and meet our guest tonight. If you've been watching us for many years, you will recognize our guest. This is Dr. Michele Helfgott. She had been an OBGYN in the area for many years, delivering lots of babies and helping a lot of women. And then about 12 years ago, switched over to an integrated medicine specialist, which is a wonderful, relatively new field in medicine. So we're going to be talking about hormones, menopause, perimenopause, things like that. But she said if you had something outside of that topic, please feel free to call in. So let's go ahead and get started.
Sure, thank you.
We'll go ahead and talk about the hormones. I remember doing a show with you quite a few years ago, and I just remember you saying, you know, people get nervous when you talk about hormones, but rest assured, they can be a good thing.
Yeah, I was excited when I was invited to come back because I really want women not to be afraid of hormones. Hormones got a really bad rap back in the 2000s when a study came out saying that it caused cancer, and
the hormone replacement
therapy, thank you, caused cancer. And really what we're finding out 24 years later is that it's lifestyle, it's genetics, it's our exposures, it's the synthetic hormones that really are the culprits. And that hormones, specifically estrogen, progesterone, testosterone, are all really good for brain, bone, heart, just well-being. You know, you and I were talking about women and their kids and how women are so busy going places, especially in the summer with sports, and even in the winter with all the sports. And women just don't take care of themselves. They don't eat right, they don't get their sleep, everybody comes first. And so perimenopause, which is the transition to menopause, can start in your 30s, actually, starting earlier and earlier, can last a long time, is when you start to get those hot flashes, maybe night sweats, your periods are irregular, you'll miss them, or you'll get 2 in a month, they're heavier, your moods start to swing, sleep issues, and then menopause is no period for a year.
So absolutely nothing.
No spotting, no bleeding, no nothing.
Okay.
You may have symptoms, you may not. Most women do.
Okay.
So the difference is perimenopause, your periods are irregular with symptoms. Menopause is no period and you'll have symptoms. And so that's a long time. I mean, if you're starting in your 30s, 40s till women are living longer now, that's a long time to be unsettled with your moods and not feeling good and not sleeping good. And so it's really important that women know what to look for and know that diet, stress, all of that plays a role. All of that can make your hot flashes worse. All of that will make your sleep worse. So it's really important to take care of yourselves. I know it's hard, but really important to do that. And then hormones are a nice option if things are unbearable, and diet helps, but it's still not where you need to be. Plus, I think women need to think about their bone health, their longevity, and how hormones can help with that.
So if somebody comes to you and inquires about that, are there different therapies out there? Like, I didn't know, wasn't there one that they could get, some do by infusion, or is it all or like an oral medication?
So yeah, so there's different types. There's oral. We like to use less oral because it goes through the liver, and that can increase risk for cancer.
Sure.
And when I say oral, I mean oral estrogen, specifically the synthetic types.
So would that be like something you take every day or once a week?
Correct. It could be every day.
Okay.
The patch is a nice option. You put it on twice a week and forget about it. That's the estrogen.
Okay.
And then the progesterone comes either cream. Well, estrogen, progesterone, testosterone comes also in a cream. Not paid for by insurance, but again, more natural route. And you would take it every day. One thing that's really important for women to know is that, especially women who've had hysterectomies and they don't have a uterus, we would tell women, well, you don't have a uterus. The only reason you need progesterone is to protect that uterus. Since you don't have the uterus, you don't really need the progesterone.
Okay.
But progesterone is so important for sleep, night sweats, bone. So even if you've had a hysterectomy, really need to consider taking progesterone, whether it's oral or a cream. Really important also that you get tested. I'm more of a fan of saliva testing. That's what I was trained under. But you can test your hormones through serum or blood. Again, I just was taught not as accurate, but it is an option.
Oh, the blood is not as accurate. Okay, that's interesting.
Well, the blood is going to measure the hormones that are bound to the receptors, kind of like a lock and key, whereas saliva is giving you the true hormone levels. So again, there's disputes and research and things like that. But the main thing I want women to know is you really should get your hormones checked. You should know where you are at rather than just starting something for symptoms, because maybe you don't need estrogen. Maybe your symptoms are more progesterone. Maybe they're more estrogen. So I think that's important for them to know.
So maybe even when you're younger, before you have issues, just know what your baseline is?
Yeah, that would be great.
Fluctuates?
Sure.
Okay.
And they do change. But yeah, it would be good to know when you, either as a baseline after having kids or in your early 40s, or if you're starting to have some symptoms, really work on getting rid of sugar, minimizing your alcohol, really minimizing your simple carbohydrates, all of which can make sleep, night sweats, hot flashes worse. And then, like I said, if those things don't work and you're really working on managing stress, you're exercising, get your hormones checked, and then consider therapy.
All right, great advice. And
Thank
we
you.
want to make sure we're not getting any calls yet, but want to make sure that you take advantage of all the expertise that Dr. Helfgott has to offer. So there's the number. We keep it up throughout the show to remind you. It's 969-2720. Again, if you're outside of Fort Wayne, it's still a free call, won't cost you anything. Just put an 866 in front of there. And I want to reassure people that we don't just throw them on the air. So there's a really nice call screener who will talk to you, and she'll give you directions. They won't just throw you on the air. And you do have that option of just giving the call screener your question if you prefer to have it answered that way instead of doing it live. So, people often make jokes about, perimenopause and menopause. I remember years ago getting a card from a woman who, at the time we were roommates just out of college, and it said something like, Jody's PMS party did not go well, did not go as planned or something. It was all these different scenes of like women throwing things or screaming, and it just looked like an absolute riot on the card. And it was a joke, but it could be just very unpleasant for women. And you're talking about many years
Exactly.
of unsettled hormones. And unfortunately, I think it's just our culture kind of takes it in jest, but I've known women who have had, who've even become suicidal because of that. And it's sad what some women have to go through. That's no laughing matter.
And again, I think it's really important that women and, teens, I think it's even important as a teen to really pay attention to your hormones and what are your triggers. And unfortunately, as you get older, you're right, the moods really swing, and that's hard when you're taking care of a family, you're working, taking care of elderly parents, to just be on all the time.
Yeah.
And you're right. And I think the more educated women are to know, oh, this isn't in my head, this isn't normal, this is something I should be looking at or getting more information on. I think that's important. The more you know, the better you can help yourself. And even though it was a joke, it's really not, and it can be very, very, very serious. And women just, I call it, the evil twin. She comes once a month, and then unfortunately in perimenopause and menopause, she stays a lot longer.
Yeah.
And so if we can work on how do we minimize that and know what we can do to help offset it, I think that's great. And it's just a collaboration of things. And hormones are just one piece of that. And that's what I also want women to know is that, and men too, I think men need to know that this is a hard time for women. And it's something that they struggle with, and it's not something that they can actually control.
Yeah, I was going to say it does impact the whole family.
Yes,
yeah, it really
absolutely.
Does. So,
yes.
And again, you talk about women, just being torn in all different directions, and it's kind of that whole thing. The scenario of what do they say to you when you're on an airplane? If you've got a child or someone you're helping,
exactly.
you put your mask on first, and then because if you're not in good shape or able to do anything, how are you going to take care of your family? So I guess. Think of it that way, but
yeah, and a great point. And I don't know what it is about, I'm not trying to stereotype, but women just always put everybody first.
Oh yeah.
And then when the kids are out of the house and it's just them and their significant other, they struggle. And so I don't want them to struggle. I want them to be proactive, and when you're busy, that's hard.
It is, and like you said, that's a huge change when you're used to being a caretaker for your children.
Yes.
And then they're not around, and then as women get older, then they lose their parents, which they may have also spent quite a bit of time taking care of their parents. So there's so many emotions and things happening, and then you've got all this
hormone stuff on top
going
of
on.
it. Yes.
So, yeah. Well, we did have somebody, Dr. Helfgott, that wanted me to ask the question for them.
Okay.
Someone named Michelle. She wanted to know, what age should women start testing their hormones? So you had said maybe even in their 30s, maybe?
Yeah, great question, Michelle. I would say if you're doing well, I would say maybe at age 40 I would start. If you're having issues prior to that, consider testing sooner than that. But 40s is a good ballpark, just trying to see where you're at. Most women in perimenopause have low progesterone. Yeah. We're born with a certain amount of eggs, and as we get older, our eggs get older, so the estrogen starts to drop. And as the estrogen drops, the progesterone drops, but that usually drops first. But I would say if you're doing well, i.e. no symptoms, periods are regular, you want a baseline, consider in your 40s. If you're having problems sooner, then do it sooner.
Is that something that you can even just take care of at a regular, checkup? Or do you, is that more, I didn't know how involved it was to go through the testing.
Yeah, great question. Usually your OBGYN would be responsible for that, although there are family docs who do who do OBGYN and do the pap smear. So either you just need to see who'd be willing to test you and review it. So if you have an OBGYN, I would say do it with them. If you don't, then ask your family doc.
And now that you're specializing in integrative medicine, I know that tends to trend more toward natural remedies instead of relying on prescriptions. So is there another whole class of hormone therapy that tends to be more natural? Like I know so many people are interested in things like herbs and things just that aren't necessarily a prescription, or a heavy drug type of thing.
Yeah, so we have things like chase tree berry or Vitex, which are types of progesterones, wild yam, and then black cohosh, dong quai. Those are all your estrogen-like medication, well, not medication, sorry, supplements or herbal therapies. But really need to make sure that you're looking at your labels, really knowing what you're taking. The health food stores here in town are great resources for that. So those are options. Those are usually options more for women in their 20s, 30s, maybe with irregular periods.
Okay.
It might help the perimenopausal or menopausal woman, may not be strong enough. Just depends on their symptoms. Only concern I have with those is that does it really help your bone, brain, and heart for longevity like your hormones do, your prescriptions do? So that's the only thing. There's research that needs to be looked at regarding that.
You know, and speaking of bone health, it just pains me because I do see quite a few women with severe osteoporosis. Usually they're quite elderly. I mean, if I had to guess, I'd say they're probably in their 80s, and I just think, gosh, that just looks horrible. I don't see it. Yes, and debilitating, I would think, to walk like that. Is that more, are you finding that is becoming more common, or is that inevitable? I mean, does everybody get a little osteoporotic as they grow older, or?
Well, interestingly enough, starting in your 30s, as estrogen starts to drop, that's when you start to lose bone. And then when you're menopausal and you don't have estrogen, your estrogen's at its lowest, then that's a huge drop in bone health. So we all will experience osteopenia, which is thinning of the bone.
All right.
Osteoporosis can be genetic, it can be, again, diet is huge, lifestyle, stress, all of that plays a role. So will everybody be debilitated with osteoporosis? Hopefully not. I don't think, we are seeing it more, and I wonder if because we're seeing people live longer than before.
Yeah, that's true.
And again, our diets have changed so much, and our lifestyles are a lot stressful. So again, all of that plays a role. It does.
Speaking of diet, I know we've talked in the past about things, and I believe me, I feel your pain out there because I go to the grocery store like every day with 6 kids, and it's expensive. But thankfully my kids do love produce. I mean, they will eat green beans till the cows come home. I mean, which is great. But I'm always torn. Like, it is cheaper to get just the regular green beans as opposed to the organic. And there are we have some great stores in the area where they sell just nothing but organic, but it's even pricier than the regular ones. Is there really that big of a deal, or do you think there's that much of a benefit to pay the added cost to just go all organic?
I think it depends. I think organic is important. I think you need to know the sources and where you're getting it from.
Okay.
I wonder how much is just having the label organic because they know you're looking for that, but is it truly organic?
Really. Okay.
So the concerns are things like pesticides, plastics. Those are all what we call xenoestrogens, which can act like estrogen. Now, I just told you estrogen's really important for you, and it is. But when you have something that acts like estrogen but really isn't estrogen, it changes everything in your body in not a beneficial way.
Yeah.
So that's the concerns with the pesticides and all this stuff that we're putting in our foods. So if you can afford organic, it would be great. Most people can't. Just do the best you can and wash your foods really well. And just, again, read your labels, and if it's got things in there that you don't know, or it's got a laundry list of ingredients, it's not something you want to buy. And for your produce, again, just do the best you can.
Yeah.
I think eating vegetables is better than not eating vegetables, and if you wash them really well, I think you'll be okay.
Just a thought too. I was listening to a podcast the other day of a mom of 5 kids. She talks a lot about good health. She gets all of her stuff from an Amish farmer.
Yes.
And this guy, I mean, she said he'll take you and show you everything. Like
that he does.
Yes. And did a lot of dairy products. So I mean, we're blessed. We have a lot of Amish in the area. I mean, that I had never thought about that, but that might be something that you could look into too.
Well, and we have awesome farmer markets around town, and we've got so many, like Columbia City, Kendallville, Roanoke.
Yeah.
So we really have awesome options, and our co-op and our health food store in Anthony and Fresh Time, all of those have just lots of opportunity and lots of choices. So we're very fortunate for that. Seven Sons is another place out in Roanoke that would show you their farm and show you how they raise their chickens and cows and all of that.
Yeah.
So definitely take advantage of that.
It's kind of nice. We're kind of on that cusp of living rural,
Yes.
you know, even though we're a city,
Yes.
but there are definitely some benefits. We did have somebody else, doctor,
Sure.
who wanted me to ask a question for her. Jackie called in and wanted to know, where can someone obtain a saliva testing kit for hormonal testing? So can you do self-testing?
You can. Actually, what I would recommend, Jackie, is we have it in our office, but obviously you'd need to be a patient, but the medicine chest on State Street, and I believe the Custom RX, those are compounded pharmacies that we have in town, and they can do the testing for you. They can give you the kit. You do the kit at home. It's not something that you do in an office. You actually take it home and do it, and they would go over the results with you and make recommendations. So I said that incorrectly, I apologize. For sure, Custom RX on DuPont Road does the testing. I'm not sure if the Med Chest on State Street does, but you can gladly call and see if they do. You could go online as well and get a test, and again, they send it to your house, but you need somebody to go over it with you. I would not recommend that you read over that yourself and treat yourself without somebody going over that with you. And one other thing I just want to say real quick, it's really important that there's a balance and a symphony, that your thyroid's in check, your adrenals or cortisol or stress hormones are in check. We look at all of that. We don't just look at the hormones. So that's another thing that I think is really important, because your ovaries, your adrenals, and your hormones and your thyroid, they all work together. And if one's off, the others are going to be off. So make sure you're looking at that as well.
Now, I'm glad you said that, because there's so much of this DIY mentality, like, I'll just look it up online. And I've had so many physicians say, do not do that.
No,
you are not, you know, you're not going to be able to interpret it. I mean, that's why we have, you know, people who, this is your profession. For many doctors in this field, such a passion to help people. And so take advantage of that, because, you know, people are looking for ways to save money, save time. And they're quick to jump to stuff online, but I know I've learned not to do that anymore. So. And
just make sure, if you do go online, that the doctor is certified, the nurse practitioner is certified, they've gone through training. I mean, in addition to my OBGYN training, I did training in integrative medicine. So you want to really make sure whoever you're dealing with, if it is online, that they are trained. And same thing with like over-the-counter hormones. Make sure they're good ingredients. Make sure you know what you're taking. Don't just take it if you're not sure, because they all can have side effects, and with your other medications, et cetera. So it's really important that you know what you're taking.
I would think, even, you know, you talked about buying these natural supplements and going to, you know, like a vitamin type of shop. I would think, though, you would want to maybe just run that past your physician before.
Yes.
I mean, maybe you're taking other things, and that's not going to be a good combination. That's kind of, I know, to me, I just would be overwhelmed. I wouldn't know how to make a good choice.
Well, there's a lot out there, and that's, again, why we do these talks. That's why we have educations and different conferences to let you know and to teach you, and so that you're informed. That's really important.
And, you know, another thing we had talked about, too, was people just want a quick fix, you know, and
there is no quick fix.
There's no magic pill.
Sorry, there is no magic out there.
Yeah. And you sometimes also talked about maybe even like people meeting as a group to learn about things, not just a one-on-one thing, but I mean, and I know we have a lot of nonprofits, like our YMCAs have a lot of educational, you know, classes for the community. So
yeah, they do, and we've got a lot of, in the community, group appointments and group conferences and group lectures that you can really learn a lot.
Yeah, so
we're very fortunate.
Take advantage of all of that,
yes.
for sure. One other thing I wanted to make just a quick plug about we were talking about trying to eat healthy and everything, but summer is probably the best time
to do that.
to start doing it, because all the stuff is so fresh. I mean, we can get a lot of locally grown stuff this time of year. So.
Yes, yes. I strongly encourage. Diet is huge. Nutrition, foundation to everything you're going to do. Your hormones will work better if you eat better and manage your stress. They really will.
And sleep is great too.
Yes, sleep is important.
We all could use more sleep.
Yes.
Well, Dr. Helfgott, it's such a pleasure to have you.
Yes,
Thank you so much.
Thank you. Good to see you again. Thank you.
Of course, our time is already up. It goes so fast,
Yeah,
unfortunately.
it does.
I sure appreciate all of you tuning in. Mark Evans will be back next week with another live HealthLine. I hope you'll join him. In the meantime, have a wonderful 4th, everybody. Stay safe and enjoy it. God bless America. Have a good night. Bye-bye.
The preceding program on PBS Fort Wayne was made possible in part by...
It's a new day at Parkview, another day to rise up and make life better for those around us. Whether that means pushing the boundaries of what's been possible, taking big strides, or sitting with a patient long after a shift has ended. At Parkview, we don't just do what's expected. We do what's best for you and your family. And we're determined to do it even better tomorrow. Every person, every day. That's the kind of healthcare we believe in. Parkview Health. We believe in better.